Good afternoon. Thank you for joining us. This COVID-19 update is being broadcast live on BCT, the Village website, bolingbrook.com, the Village Facebook pages. Closed caption during this live broadcast are available on the Village website and the Village Facebook pages as well. Captions will be available on BCT during our rebroadcast. Transcripts are also going to be available. I am joined here this afternoon by our co-administrator, Ken Teppel, as well as Obed Cruz, the VP and Chief Nursing Officer from Amita Bolingbrook Hospital. As many of you know, the governor has added additional mitigations beginning tomorrow at midnight. Today, we are here to share with you how this will impact our community, as well as share some factual data. Please know that our number one goal is the safety of our residents. The Village will continue to advise everyone to adhere to the recommendations of the Illinois Department of Public Health. Please wear masks, practice social distancing, and frequently wash your hands. The Village will continue to share resources that will support business owners and our community as we work towards recovery from this pandemic. With that, I will have Mr. Ken Teppel give us some facts and numbers and share with you some of our data.
Thank you, Mayor. As Mayor Basta mentioned, my name is Ken Teppel. I'm one of the co-administrators here at the Village of Bolingbrook, and I've been tracking COVID since its onset. It actually hit our radar back on around March 21st is when our first testing site opened here in Bolingbrook. As the Mayor mentioned, there are some new mitigations taking effect starting at midnight tomorrow, Thursday into Friday morning, and you've probably heard them ad nauseum by now, but a little bit about them and how they're going to impact the Village of Bolingbrook. Bars and restaurants, everything stays the same as far as the protocol for them. Outside dining, 6 feet, the groups have to be the same party at one table, and they have to close by 11 p.m. and can't open any earlier than 6 a.m. But where it starts to get into the fine details is for health and fitness centers. So now health and fitness centers can only operate at 25% normal capacity. There's no more indoor group classes. Face coverings must be worn at all times. So before, if you were working on a machine or you were running the track, you could have your face mask off if you were the only one in the area. But now you have to wear a face mask at all times while engaged in individual exercises. Reservations are required, and locker rooms are closed. So you'll have to wear what you're going to wear inside the facility and then wear it back out. As far as hotels within town, the occupancy is limited to the registered guests only, so no getting suites and inviting people over. The fitness centers should be closed, or if they are operated on a reservation-only system, 25% capacity. And event and meeting space is closed. So if you are holding a gathering, meeting, a club organizational type of at a hotel, contact them immediately if they haven't got in touch with you already, but those spaces are to be closed. That gets me into organized group and recreational activities, which includes all indoor and outdoor sports. So sporting and recreational activities, including youth and adult recreational sports, must be paused. And I guess at a later time they can pick up and resume. But individual training may remain with facility reservation. So, this includes park district and travel leagues. Outdoor sports and recreation is allowed. So if you want to go out and play tennis, you can. You want to go play softball, you can. Throw a football around. It's going to be nice the next couple days. You can. Participant groups and practice outdoors are limited to 10 people or less with social distancing. So if you're going to have that Thanksgiving football game in the morning, it's okay. Face coverings are required for all activities at all times. And again, locker rooms are closed. Now, personal care services. So for your hair salons, your nail salons, those type of areas, they have to operate at 25 clients or 25% capacity. Face coverings must be worn at all times. And if in case of a massage or physical occupational type of service, that has to be mandated by a healthcare physician. So, and then it has to be sanitized between each person. So that's kind of a little nuance this time. And retail. So as far as retail, our big box stores. So if you're looking at Walmart, Costco, places that sell groceries and pharmacies, but also offer other type of home goods, they are only allowed to operate at 25% capacity, such as general merchandise stores. Grocery stores and pharmacies may operate at 50% capacity. So how that affects the village of Bolingbrook, the actual grounds here at Town Center, all of our meeting space, our community rooms at the fire stations, Town Center, over at the community center, they're all closed. They're all closed until further notice. Someone should have reached out to you and explained that any event you may have had there is going to have to be canceled, and we can reschedule with you. Also, our museum. We have a museum out at the airport and a museum, Natural History Museum over on East Briarcliff. That is closed too, temporarily, until we have word otherwise. Any indoor recreational activities, museums, zoos, that type of stuff, is going to be closed temporarily. As I mentioned, I've tracked COVID since March 21st. I think I was the second test over at the Walgreens Center. We have numerous places in town that offer testing. The hospital here in Bolingbrook, Amita Bolingbrook, offers a COVID testing. I mentioned Walgreens on East Boughton. They offer, one of the first to offer COVID testing in town. Physicians Immediate Care in town. A lot of private doctors and physicians in town are offering COVID testing. The Will County Health Department is in town offering COVID testing. So do your research, get on their websites, give them a call, find out what their parameters are. If you have to register online, you have to have a doctor's note. If you're signing up for a rapid test or the PCR test, which takes anywhere from 2 to 4 days, depending on the backlog at the laboratory. But there is testing available in town. So I hear a lot that COVID is running rampant in Bolingbrook and that, you know, it's not safe to go outside. And I'm like, where are you getting that information? Where's that data coming from? And I'm always one that I like to cite my source, and so I can go out and do the research. So the data I'm going to give you today is directly from the IDPH, Illinois Department of Public Health, and it's crunched, if you will, through the Surgical Outcomes and Quality Improvement Center at Northwestern Medicine. So they're taking all this data and this historical data that the IDPH puts out there, and they're breaking it down into 7 and 14-day increments. So it's easier to track, if you will, and compare apples to apples. If I go online through the IDPH website, the Illinois Department of Public Health, it'll give you historical data. And I can tell you that since March 21st, when we first started testing in Bolingbrook, our rate is 7.84. I'm sorry, 7.89%. That's our historical rate. You're going, that's not that bad. Well, if you go to the Northwestern data, where they're taking that state data and crunching it and putting it into increments, that's 7 and 14-day data, that can be found at, and we'll put this on our website, it's COVID, COVID hyphen dashboard dot FSM, F as in Frank, S as in Sam, S as in Mary, .northwestern.edu. You can try Googling that, but that's the actual the web link where you can get to it. So Bolingbrook is on a 14-day outcome because, you know, they say 14 days you should quarantine, so it's a nice number to pick. 2 weeks. Our 2-week positivity rate is at 14.24. So I went to all of our other surrounding towns around us and said, okay, how do they rate? Are we really that bad? So Naperville is the best one around us. They're at 11.48. Woodridge, to our north east, is 16.7. Plainfield is at 19.15 positivity rate, and Romeoville is at 18.43% positivity rate. And the entire County of Will, now I didn't have the data for 14-day, but for a 7-day on County of Will, that's 19.9. So looking at all of those numbers, Bolingbrook is doing pretty well at 14.24. Are we on the increase? Absolutely. Everyone is on the increase. You go to the webpage, you can check, and there's a graph, and you'll show our data as it increases and goes up and down. You can also see the methodology on that page on how they got to where this data is. But, you know, the data is out there. Try and find a reputable source. We'll put these links up for you to go out and do the research yourself. If you want to check any other town in the state of Illinois, these websites will allow you to do that, to compare that if you have relatives living there or you have family or friends or just are wondering what's going on in that area. Another part that I hear sometimes, and I'm in very, very close communication with my counterpart and our friends over at the hospital here in town, is that, oh, it's terrible there, and things are patients are being turned away, or it's being overrun by COVID. So I called a friend of mine, Obed Cruz, the chief nursing officer, and he is here today. We invited him out to speak to you today and explain kind of a little what's going on there and their protocols and what they're seeing and their trends in the healthcare profession, and offer some tips and possibly some encouragement in these kind of darker and bleak times. So if I can turn it over to Obed.
Thank you, Ken. It's an honor to be here in the village of Bolingbrook. I'm so happy to be a resident here for almost 3.5 years and working at Bolingbrook. And I can tell you that the hospital is really seeing some interesting days. And I'd like to share some of what's going on in the hospital and dispel some of the rumors. So first of all, the hospital is busy as expected. That's no surprise. Every hospital is busy at this time, and we're no different. Right now, we have about 50% of our patient volume is COVID positive, but we're turning over about 25 to 30% of those patients every day. That means they're going home and they're coming in. So is it busy? Yes, but we are managing it. The nursing staff and the physician staff are resilient. They know more how to treat this, and they're doing an incredible job in treating COVID, and with the knowledge they've gained in the last 8 to 9 months. So we don't turn away patients. There may be delays sometimes because we have volumes that we did not expect, and I think many hospitals are in the same position, especially when in the area of outpatient COVID testing. One of our sister hospitals did go on strike earlier this year, and they were a designated hospital. We ended up taking up a lot of that volume. So currently, we're seeing some pretty high numbers in the neighborhood of about 1,000 tests a week, strictly of walk-in. We don't schedule people for days out. If they need a test and they come in with a prescription or have it faxed in by their physician, they can have the test that day. And we're working to improve that process every day so people can wait in their car, for example, instead of waiting out in the cold, because they do come in the hundreds, roughly to around 150 a day. So we are also working on telehealth capabilities throughout the system, including our own hospital, since we have to limit visitors for the safety of the employees and just each other. We have restricted visitors, but we haven't eliminated them. There are certain circumstances that we allow visitors to come in, and those are very special, and we manage those. The safety measures that we ensure in the hospital are also continuing through the activities. For example, recently we had a food drive in the hospital, and we made sure that we maintained all the safety measures during that food drive this last week. So what can we do to make things safer? What message would I want to hear if I was in your shoes? Well, I went to our infectious disease specialist today, and I said, what top 2 or 3 things can I say to the community so that it will be significant, especially with the holidays coming up? And so I'm going to echo what our mayor said a little while ago, and that number 1 is to wear a mask. Wherever you go, you wear a mask, especially when you're going to indoor places. Let that be just part of your wardrobe. You have to wear a mask. You are protecting yourself, you're protecting others, your family members, etc. Number 2, we have the holidays coming up, and this came up more than once today, and that there's a big concern with the holiday gatherings. I'm sure that you are no different than I am, and that you're looking forward to seeing family, and the highest recommendation is to just stay within your own family, immediate family, meaning those that live under your roof. If you're going to have more than that, wear a mask. I know that's difficult. Doesn't seem personable, but it will protect you, and you don't know who you're protecting that may be visiting, or protecting yourself and your family. So family gatherings, your immediate family, anything more than that, wear a mask, even indoors with them. Hand washing, number 3, top thing, hand washing. Wherever you go, you should have your own little kit. I walk with it everywhere, and I don't go anywhere without it, because you don't know what people are touching at the grocery store, at the commercial places. You don't know, putting gas. You need to protect yourself. And those 3 things are kept on being repeated over and over again. I want to talk a little bit about the treatment. We know more than what we did before, and the doctors are much more aggressive, and patients that are coming into the hospital that are symptomatic enough are being admitted for approximately 5 days for treatment, and then they are released. That is based on all the evidence that we know, and the physicians are following it closely and adjusting as we go along. And so the treatment is better now. It seems like the numbers of people going to ICU and the mortality is not what it was several months ago. So we're happy to report that. We're not out of this yet. We are definitely in a concerning time in Bolingbrook Hospital, but we are managing through it. Our emergency department is open 24/7, and we do hold patients there at times, and it varies. One day it could be higher, and the next morning it's a very fluid process, and since we discharge a lot of the patients, everybody could be moved on a dime. So that is something that there's not one hard answers to, but it is a fluid process every day. And I'm proud that the nurses and the doctors serving this community have become very resilient during this. They have the experience of the last 8 to 9 months, and they're doing an outstanding job. And I know there's a lot of what I would call a little bit of drama on healthcare workers and how they're just, overwhelmed, and they are overwhelmed. I understand that. But we're with them every day. We're providing the support. We're looking at their needs, not only physically, but also their needs spiritually, emotionally, so that we can make sure that we optimize and have as balanced of a process as we can with our employees. So we are fortunate in Bolingbrook to have the relationships that we have with our community partners like Ken and Fire Rescue. We're literally on a first name basis and on a cell phone relationship, and we're here to serve. And I can tell you that I am very proud of what Bolingbrook Hospital is doing for the community, and we look forward to this being ending up in a better direction in the near future with what we're hearing as far as a potential vaccine coming aboard and us getting back to a normal life. So thank you, Ken, and I'm willing to take any questions you have in case you have any.
I do, thank you. We spoke a little bit about patients coming into the hospital and turning patients away and elective surgeries. Can you touch a little on that and how that's kind of a metric for you?
Absolutely. Actually, I just got out of a meeting with surgeons and physicians regarding that very issue, the elective surgeries, and that is a case-by-case basis. The physicians are making judgment calls on the knowledge that we give them every day, and it changes day by day. Patients get a COVID test prior to the surgeries, before, and the physicians, if there are surgeries that can wait, they are waiting on those, because if they're not life-threatening and they're not emergent, why risk anything that can actually wait? So it's really a surgeon by surgeon decision, and it could change literally day by day. But we're having good communication. We're open about our information so they know where we stand every day, and we have a chief medical officer, Dr. Carol, who is at their disposal at any moment in case they get in a situation where they're saying, should we or shouldn't we? So that is looked at every single day. And we meet every day a couple times to discuss the numbers, what we have coming in, the cases, and any patient flow strategies that we can initiate to really make a better experience in the midst of this pandemic.
Thank you. And the hospital is not on bypass. I mean,
No.
it's open. Patients are welcome. And then
Yes.
if they need to be redirected to another hospital within your system, you facilitate that.
Yeah, we definitely. That is a process that goes through the legal requirements of being able to transfer someone and needs the patient consent at the end of the day. So we do that with our sister hospitals, and we've done that in the past several times. Most of the time, patients just want to stay. This is the hospital. We not only serve Bolingbrook, but we're serving Plainfield, Romeoville, and people are close to this hospital geographically. So there are not a whole lot of takers usually to the transfer process, but we do make that attempt if we see that there's a bottleneck there, and of course with the consent of the patient and the family.
And lastly, you mentioned that the treatment is much more aggressive now than it was in the beginning. It was, go home and monitor yourself for 14 days and call, EMS if you need to come back and see us, or have a telehealth with your personal physician. And you mentioned that you are admitting more people with a much more aggressive type of treatment. With that, you hear the stories about how deaths are going up and increasing. Do you see a correlation between the increase in our COVID positivity rate? Does it translate into an increase in deaths, or because of that aggressive treatment, you think you're mitigating that?
I think it's being mitigated with the aggressive treatment, and the aggressive treatment goes all the way up from minor to just major, in a criticality. So I think the middle of the road patients that do have symptoms, but they don't seem to, they shouldn't go home, but don't need to really critical care. Those are the ones that are the bulk of the patients. And those are being treated very aggressively from day one. The infectious disease specialists are on board for all of those patients. And we're seeing that in 5 days, usually they can just go home. And so far, it looks like it's working and working well. So we are seeing more patients, more COVID, but we're also testing at incredible numbers. We were not testing like this 6 months ago. When we were on that Sunday, I think at Walgreens, talking about how this was going to go out, we did not expect to be doing 1,000 patients a week through outpatient testing COVID, but we're in a different day now.
Oh, correct. Obi was there it was March 21st. It was snowed and it was cold, and we stood outside and tried to figure out how this was going to affect the village of Bolingbrook and how it was going to play out. Walgreens was one of the first partners we had, and we welcome them and all our other partners in COVID testing, and appreciate everything you're doing for our town, and also the partnership you have with the police and fire department and the village of Bolingbrook. So thank you for coming out. And Mayor, I would like to turn it over to you.
Thank you, and thank you, Obed. We understand that our community is not only facing the pandemic, but also facing the flu season. With that, we will be continuing to rely on our physicians as well as science. And we're very fortunate to have Amita Bolingbrook in our community, as well as an open relationship between the staff at Amita and the village of Bolingbrook. All the information that we provided here today is available on the IDPH website, and we will be updating our website as well as social media on a regular basis to keep our residents updated as much as possible. On behalf of myself, the mayor, as well as the board, we ask that adults make responsible decisions. Business owners also have an obligation to operate in a responsible manner that upholds health standards and keeps our consumers safe. The public must maintain their responsibility to wear masks to minimize exposure of the virus. We trust that our community will come together and be mindful of the factors as we move through mitigation and navigate through this pandemic. Thank you very much for your time. Wear a mask, socially distance, sanitize, and stay safe.